a patient to the hospital, whichever private or public. And sometimes the patient may want to go to private, but because you sort of suspect that the condition may need a very long length of stay for care or very expensive procedures, what do you do then?
Generally, I would advise my patients also, depending on the urgency of their condition, whether they can wait. One good example is a lot of patients go for their diabetic retinopathy eye screening, and then the waiting time for some public institutions can be up to 6 months or 1 year, and that's actually beyond what is recommended by the eye specialist himself. So then these patients will refer them to the ophthalmologist in private. When it comes to hospital stays and longer courses of treatment, of course, then that's when understanding of the specialist that we're referring to is helpful, because when we refer to a specialist that we know and we trust, then we will avoid a lot of the potential pitfalls of a long stay or over servicing or all sorts of issues. Then some patients, whether they will benefit from a public hospital versus private, actually, to be honest, I feel that both the quality is actually pretty good, pretty decent. So but of course it depends on the patient's ability as well to pay. So if I feel that they may face in some financial difficulties, then public hospitals are probably the most cost effective or cost saving kind of place for the patient.
I think I agree with you, but I think on top of that, public hospital have this thing called Medifund.
To help them.
It's 3M, right? So Medifund, whereas private hospital doesn't have that. So the desperate ones, sometimes we still advise them to go to public hospital, then get themselves into the subsidized class. Then if really worst of the worst, go to see a medical social worker, try to get Medifund to help. So there are many ways actually in Singapore, except that some of these ways are actually available only to the public sector and not the private sector. So sometimes I advise my patient that way as well.